So hello and welcome, my name is Stephen Davis and I'm a registered nurse. This section we're going to talk about infection control training and why it's so important. We've got a series of learning outcomes which we need to cover during this session, starting at the top around legislation, moving all the way down to ways in which we can prevent, and we're going to look at some treatment plans. So why is it important that we have a good understanding of this? We know infection can spread quite quickly and can be very harmful to health. So let's look at what the law tells us. The law tells us that we need to work in a safe environment, and that us as employees and our employers need to provide us with the resources we need to carry out our jobs safely and effectively. And that will cover things such as PPE, welfare facilities and the ability to wash our hands at work safely. You can see that we have another array of other legislation, some directly involving infection control, but we have other ones that's more common, such as the Food Safety Act. So if we're preparing food and drink for people, it's important that we do this in a safe way. We've got the Controls of Substances Hazardous to Health, 2002, so formerly known as COSH. So that's around the chemicals that we're using to ensure that we're not exposing ourselves unnecessarily. And down at the bottom, we've got RIDDLE, which is the Reporting of Injuries, Dangerous Diseases and Occurrence Regulation. So we have an array of legislation here that we need. Moving on, depending where you are in the country, Wales, Northern Ireland and Scotland then have their own policies and legislations as well. So let's think about dress code to begin with. I see an array of people wearing lots of different things when out and providing care. And what's important is to understand some of the logic behind why we do what we do. It is important that we dress in a way which presents a professional image. Care is all about trust, and people want us to look professional, and if we look professional, it gives the right confidence. We need to think about if we're preparing food or if we are dealing with infectious diseases, are our clothes contaminating and cross-contaminating things? If we're wearing loose things, such as scarves that come down and jackets, they can sweep across the side and pick up infection. And finally, it's important that we follow our policies around infectious outbreaks, because again, we need to try and reduce the spread of infection. There clearly is some specific guidance out there. So let's just start at the top. When we have our hair should be tidy, it should be tied back. So if we have long hair, we need it tied up in a bun and away from our face, because when we move our face, the hair will brush across, and if we're picking infections up from our hair, it can go into our eyes or into our mouth. But more so, you could pass that infection on to other people. So if your hair's dropping, it could sweep into their face. So facial hair, we should try and keep facial hair to a minimum for gentlemen. So again, beards, we know hair contains bacteria, so it's important we keep those short. Earrings should just be simple studs, nothing too extravagant. Two reasons. One, so stones don't drop out. And two, if you've got looped earrings, they're more likely to catch on things and they become a hazard. Moving down our necks, we shouldn't have anything around our neck and face, because when we bend over, the material reaches our mouth, and again, whatever's on there can start to contaminate us. As we move down, it's important that we think about how we're going to hand wash. And hand washing is one of the most important things we can do to reduce cross-infection. So if we've got long nails, they need to be short for infection control reasons. And not only that, you know, if you have long nails, you could scratch a patient, and we don't want that. Jewellery should be kept to a minimum, so the only thing that you should have is a wedding band, and again, ideally without stones, because the bacteria can harbour in those. No watches on the wrists or bracelets, because when I wash my hands, I go round my wrists, and actually if I'm wearing jewellery, that's impossible. Also, if I'm wearing jewellery and I'm moving and handling somebody, that jewellery could catch and scratch. So again, we don't want to do that. Moving down, tight clothing. So the clothing should be tight around the body and the waist, so I've not got pieces of material. And I'm not wearing my neck chains, my lanyards, they're down on my hip, because again, when I bend over, they touch the patient and they become a form of transmission, and we don't want that. So we do need to wear sensible clothes to work. My advice during any infection outbreak is to wear a polo top, because these are quite robust in washing machines, and some hardy trousers. Keep your clothes away from the rest of your families and wash them separately. So there are tips around what to wear. Now, looking at the definition, we know that infection could be local, it could be systematic, it could be localized. So in other words, infections can sometimes stay in one area due to maybe temperature and regions, and others, they can spread quite quickly. We have different types of microorganisms which can pass on infection. We have bacteria, which can multiply and grow incredibly quickly. It takes 3 million bacteria on one pinhead to cause food poisoning. And the way the bacteria works is it starts off as one cell, they divide and divide and divide. So within 20 minutes, you could have enough bacteria to be harmful. Viruses, such as the CV-19 or the flu or influenza, transmits in a very different way. So it could be direct or indirect. So we can touch things and leave a mark, or alternatively, we can cough and sneeze and spread it that way. If we move down and we look at fungi infections, so they're normally transmitted through maybe athlete's feet or maybe verrucas or things like that, in which we can leave things around and obviously pick up infection that way. And then finally we have parasites, so we're talking about body lice, head lice and bed bugs. We have what's known as the chain of infection. It's important to understand this, because if we're due to try and challenge or defeat any infection, we have to understand how the chain of infection works. So we normally have the infected agent, so that could be the person or an item. It moves through and droplets are left. It then has a means of transmission, so it could be somebody touching, coughing or sneezing. It can enter through the body, so it can enter through the nose, eyes, mouth or any broken skin, and then it will then find another host. So it just keeps going around and around and around. But if we take any of these away, we have an opportunity to reduce the chance. So what does bacterial microorganisms need? So again, bacteria, virus, fungus and parasites. They all need food, so that could be skin cells or anything else. Moisture, so again on our skin we have sweat. Time, well, it has plenty of that. And again warmth, so at the ambient temperatures, room temperatures. We know for a microorganism to thrive it only needs up to 20 minutes. It's really important we wash our hands continually throughout the day to try and beat any transmission. So how does it transmit? Well, we have, as I said already, the direct or indirect. It can go airborne, it can pass through the toileting system, through fecal, it can pass through blood transmission, or alternatively it can be transmitted through insects. So what are the standard principles? There's an array of standard principles that all services should be working towards. We should all understand our safe practices. So our safe practices involve good hand washing, good drying of the hands, making sure that you're wearing your PPE, thinking about your work environment. So in an infectious outbreak, we should have a very clear, clean area so we can disinfect and sanitize as we go along. We need to make sure that we're not overfilling bins. We need to think about door handles and not touching keypads in common areas. We can look at other things as we go down around vaccinations and health checks. So again, making sure that the staff are well and that there's some wellness programs. So we're looking after our own immunity system, eating well, sleeping well and taking plenty of exercise. Coughing and sneezing or respiratory hygiene is really important. So if I cough, we're going to cough into a tissue or sneeze into a tissue and bin it and then wash our hands. Or alternatively, we'll go in for the shoulder and sneeze into us to try and stop the spread going. It's important that you have plenty of PPE and you're aware of how to use those. Normally during an infectious outbreak, we're looking at face masks, aprons and gloves. If you're handling food, it's important that you've done your food hygiene training and you're aware around basic concepts of good food safety. Again, thinking around handling sharps, your uniforms, working in a safe area and the way in which you're going to get rid of rubbish. So there's lots of standard things that we can do every day to help beat a virus or infection. So I've said this a couple of times now, so good hand washing is essential for making sure that you maintain your own personal hygiene and the safety of others. So we would turn the taps on, we would put a bit of water in our hands and then put the lather, the soap in our hands, and we're going to wash in between our fingers. So it's really important that we kind of grip and we go in because we want the soap in all the grip, in all the joints. Once we've done this, we're going to do our knuckle shuffle. So we're going to kind of grip ourselves like this. And the idea is we get the soap under the nails to try and help there. We're going to come down off the thumbs. And again, we'll get the rest of the lather and we're going to go round our wrists. So show you one more time. We're going to go in between. We're going to shuffle. We're going to do the thumbs. And then we're going to do the wrists. So that whole process should take roughly 20 seconds. And you'll use the same process whether you're using soap and water or alcohol gels or the sanitizer gels. Let's now dismay all myths. Alcohol gels should not replace good hand washing. If you have running water, you are far better off using this other than the sanitizers. The sanitizers really are there for two things. One, to top up the hand washing, to really make sure that you've killed the bacteria. And two, to be used in a time of emergency. So if you haven't got access to fresh running water, use it then. But the hand sanitizers should not be used as the primary source of hand washing. But then we've got the problem with the drying. So depending on where you are, it's really important that we dry properly. So again, we can shake our hands in the sink 12 times to reduce the excess of water. We can take one paper towel, we fold it, and then we can pat dry. And when we fold the tissue, it doubles up its absorption rate and it makes it easier to take the water off the hands. So we should only need one towel to dry. So what else have we got? We've got lots of policies in which your company will have written to help to reduce the spread of infection. So therefore it's important you are aware of your company's policy and they should be available on the company's websites for you to download. In there, it will talk about how to work with your service users, family and partnerships, working with an outbreak, what would happen maybe if there was a neurovirus around the diarrhea and vomiting, or indeed the CD19s. What to do in the emergency situation, what happens around the staff and the vaccinations and how we keep up our immunity, how we're going to report sickness, and again, who to contact. You'll have lots of procedures as well, so the ways of doing things. So it's important you're aware of all of these processes. So what to do if you were exposed, how to wash your hands, how to sneeze, how to put on the PPE. Again, when we put on our gloves, when we take them off one at a time and we try and fold them into themselves to make it easier to reduce infection. Aprons, again, we untie and we roll them up so we don't flick the infection everywhere. Again, same thing's going down with your uniforms. So again, this is why it's useful just to have some plain clothes for work, so you know when you get home you can strip off, you can put those directly in the washing machine and you can shower. You must know how to deal with infectious materials. So again, have you got yellow hazard bags ready for incinerating, and obviously know things around end-of-life care. So what to do during an epidemic or an outbreak. Have we got things like do not resuscitate signs, and are we aware of some of their needs, wishes and wants, and we'll talk about those when we do the end of life care training. So let's look at the typical signs and symptoms of COVID-19. So here you can see that you can carry the disease for up to 5 days without any signs or symptoms. So that might be you're a host to the virus and it hasn't actually attacked your immune system. After the 4 to 5 days, you might start to show signs and symptoms. And here, if you do, you may hold those signs and symptoms between 2 and 14 days. So again, different for different people, for different ages. You may experience things such as a fever, so a high body temperature. So for a high body temperature, we're looking for anything over 37.5. You may have a persistent cough or a dry cough. You may feel fatigued and you may have shortness of breath. There are other uncommon symptoms for this one, which is a runny nose, sore throat, headaches, body aches and pains, and diarrhoea. So what can we do to keep ourselves well during this period of time? If you do smoke, try and reduce your smoking down as much as you can. This particular disease that we're talking about attacks the respiratory system, and therefore it's important we're looking after our lungs as much as we can. Try and eat as much fruit and veg as possible, take regular exercise, try and maintain a good healthy weight, avoid alcohol and any drink in moderation, ensure you have good sleep hygiene, and take steps to avoid the infection, so ensuring you're washing your hands and you're cooking your food through well, and try and avoid any stress. Now, on the treatment side, it's unlikely in most bacteria and viruses that there are treatments. Sometimes you just have to let the virus or the bacteria run its course of time. There may be things such as antibiotics that can help, but in most viruses, antibiotics won't actually help. So it's important that you seek medical advice on the right steps. However, what we can do, even though we can't treat the virus, we can treat the signs and the symptoms. So for example, if you have a fever, so a high temperature, start to record it so you can track the temperature, because there may be certain times of the day you see it peak and drop. You can take 2 paracetamol every 4 hours to help reduce your body temperature. You could apply a cold compress to the forehead and to the pulse points on the wrist, and open the window and get plenty of fresh air. You may experience a cough alongside this, so if you have a cough, we suggest you drink plenty of water. You can drink herbal drinks such as herbal tea or ginger and lemon, but try and avoid the diuretics such as normal tea and normal caffeine, because they can irritate your throat. You can suck on lozenges if you have them available, and again, you can gargle in salt water to sterilise your throat, so to clean any infection in the back of your throat. Fatigue will be common because you're going to feel tired and worn out. So it's important that you get adequate rest, try and eat a healthy diet, practice some relaxation techniques, and again, reduce your coffee and alcohol intake. Moving down, we're going to have shortness of breath. So again, there's certain things we can do here. If you are smoking, please stop smoking. Avoid exposure to pollution, so try and avoid things such as dust or allergens from your pets. Don't do anything that's going to increase your heart rate and speed up your breathing, because you're already short of breath, so take things nice and slow. When you breathe out, put your lips together like blowing out a candle, and this is called lip breathing. So it's very much a case of just taking the shallow breaths. If you've got a runny or a sniffly nose, you need to rest as much as possible, drink plenty of fluids. You can take some nasal sprays to help with the decongestion, and there are things such as humidifiers and things to help with congestion. Again, if you have a sore throat, you can take warm liquids, gargle with the salt water, rest your voice, avoid dry air, and avoid irritants. You may have aches and pains, so here we recommend an ibuprofen, so again you can take that with paracetamol, but don't take it at the same time. So what we recommend is you do a staggered dose, so paracetamol, then 2 hours later take your ibuprofen, and then 2 hours later you can then take your paracetamol, so you're not overdosing on paracetamol or ibuprofen. And finally, if we look at diarrhea, it's important we maintain our fluids and our electrolytes, so again you can take things to help keep you hydrated. So what are the real concerns if you contract a virus or a bug? 3 things that we need to be really mindful of. One is sepsis, so if we have got a temperature and that temperature is not coming down, we should start to be worried. You may see blotching of the skin, and again if you start seeing rashes and things, we need to start getting medical assistance immediately. The person that you're caring for may go into shock, and that'll be common if you've been diarrhea and vomiting or sweating a lot. So it means the body's running out of its natural fluids and we need to start getting them onto saline. So it's important that we get the medical assistance immediately. And then finally, you may have pulmonary edemas. So again, that's fluid that builds up on the lungs and the crackling, and you can hear that. And again, any signs of pneumonia or edemas, we need to make sure that we get medical attention immediately. So let's just conclude what we've covered in this session. We've looked at some of the legislation, we looked at health and safety, we looked at the Food and Hygiene Act, we looked at RIDDOR and COSH. The risk assessments are all about keeping yourself well and doing whatever you can to reduce the risk of you getting this, so following the processes and principles that we talked about. We looked at what a virus was and how it can be transmitted, and we looked at the chain of infection there. We talked about how infections could be spread by direct or indirect contact. We've talked about how we can prevent this, so good hand washing, cooking your food, and finally we talked about some of the policies and procedures in which you need to follow at work. If you have any concerns, please talk to your managers or your 111 services to gain any further information. If you need to find any other information around infections, you should be able to find those on the government websites or in NHS England's website, and you'll find lots of information around other where to go for advice and guidance. So thank you for watching. I hope you found this session helpful.